Hello, everyone, and welcome to TVLovesMe Talks. My name is Usman, and I am back with another episode of my podcast. And I thought I'd keep it to something I actually know about rather than talking about topics that are in the news. So I'm going to keep it to something in my field. And we're going to talk about the vaccine, which is on everyone's lips at the moment. Everyone wants to know about it. I'm getting calls all the time about, should I take it? Shouldn't I take it? Is it safe? All of these different things. So I thought I'd bring on an expert in the field. Those of you who watch my channel, who've seen my other videos, know that every single person that seems to be on my channel is also called Usman. And today is going to be no different as well. I have found another Usman. I am joined by Dr. Usman from the Dr. Uz podcast, who is a GP. He's a sports doctor, and he is the host of a very fantastic podcast. So if you're into sports, especially, he's got some amazing guests on his podcast. So make sure you check it out. His app will be in the description and the title. I think he's at Carlos Takam, which I really enjoyed. And I think there's one upcoming with Marlon King.
Marlon King this weekend.
Marlon King, yeah. So I'm looking forward to that one. And I've got to respect the hustle, brother. He's a GP. He's got his 9 to 5, 9 to 6, whatever. But he's smashing out these podcasts. I think it's 94. This is going to be, isn't it? This
one? 94. Yeah.
So anyway, welcome. Thank you so much for joining me today.
Thank you, Usman. Thank you for having me. Thank you. It's a pleasure to be on.
Yeah. No. Let's get down to business. Obviously, you are a GP, so you are the person in the community that we all look towards for our information when it comes to medical matters. Obviously, pharmacists as well, but obviously doctors are doing their bit as well.
Yeah.
So I think there's not anyone out there who doesn't know what the virus is and what it can do to you. So the dangers of the virus. We won't go into conspiracy theories about whether it even exists or doesn't exist. We know you've seen people suffering with it. Obviously, unfortunately, I know people who've passed away from it as well. So something that we definitely need to be aware of. But other than a cough, a persistent cough and sore throat, is there anything else that we need to look out for? Because a lot of people may get other symptoms and they kind of brush it off and say, no, it can't be that because it's only cough. But is there anything else people need to watch out for?
3 symptoms as per the government guidelines: new cough, new fever, or new loss and taste or smell. I often say, persistent fever, to the point where even if you can't measure your temperature, you're, for example, shivering in bed and you've got the heating on, or your body temperature feels altered. At that point, I wouldn't hesitate. You need to get yourself tested. And obviously a new cough. I know it's obviously a bit difficult for asthmatics or people with COPD. They think, I'll get this cough all the time. But it's just better to be safe than sorry, really. Testing is rapidly available now. It's not like how it was this time last year where no one knew where to get tested.
Yeah.
Those 3 symptoms, I'd say, people that I know have presented with other symptoms, but it's always been a fever. That I know one of the professional athletes I work with, a professional boxer, he had a fever and he had diarrhea as well, but there was the fever still there. But essentially those 3 core symptoms: new cough, productive or non-productive, new fever, and new sort of loss in taste and smell.
So even if it was mild, let's just say you thought, I feel a little bit warm or whatever, would you say, look, definitely go do it?
And one of the nurses I worked with, she was like, I thought it was a mild fever and I had sinusitis symptoms as well. And she went and got tested and she had the virus. There's no harm in going and getting tested. At the most, you'll have to isolate for 24 to 48 hours when that result comes back. A lot of times now, now there's rapid testing, where you can there's home testing kits and there's results where you'll get the result within 2 hours. They're not 100% accurate. They're not as accurate as the full PCR testing.
Yeah.
But if they come back positive, then obviously that you've got to get the proper tests. But I just wouldn't hesitate, and go and get in the test. It's not like it's not available now. It's just better to be safe than sorry.
Yeah, I think we're probably going to touch on this a little bit more. It may not even be the fact that you might still think, you know what, I'm okay. But if you're going out and about to work or you've got other people in the house, obviously these are the things that it's more reason to do it rather than personally for yourself. We're going to get to that anyway, about why some people may think that they don't need to get tested or might not need the vaccine. So a lot of things in the papers at the moment, a lot of people are talking about, I've seen a few adverts on TV about people saying, oh, you should, celebrities mainly saying, go get the vaccine. It hasn't got a microchip in it. It's safe to use. It's been tested, but go and get it. My question to you, obviously, I've seen where, obviously, in my line of work, that the patients nowadays they've changed. It's not how it used to be, where obviously, correct me if I'm wrong. I don't know if you see it as well, but when you tell them something, they're going to take it for fact. It's like the doctor said it, the pharmacist said it. It's the way. Now, obviously, I get a lot of people who are just have done their own research. Obviously, they've done their 5 years degree on Google. And you know what I mean? It's like, what have I done 5 years for?
You guys obviously, after my 5-year medical degree and my training doesn't work, your 4-year degree and your pre-med difference, mate. They've done their stuff on YouTube and Google, but you have to think of it like this. Put it in their perspective, and a lot of people, a lot of them. It's different from me and you, we're educated people, but a lot of these people who aren't educated and their degree, their sort of science knowledge goes to maybe like a D at GCSE biology, and they dropped it. So it's the uncertain. Like, it's not, if this was a virus and there was no lockdown, people would go out and get the vaccine, they would do. But because there's been so much implication on people's lives, the lockdown, no jobs, this, that, people are essentially, their livelihoods have been taken away from them. So they're growing frustrated, and then they start to question things. Instead of thinking this is a virus which is killing people, they look to blame the government, Bill Gates, Jeffrey Epstein, all these other people for this virus and stuff. So it takes a mind of its own. But back to the actual matter, you're right. A lot of people, they don't listen. Like I say, I always think it's the patient's choice at the end of the day. You can give them information, you can take them to the well, but you can't make them drink the water. You can give them information, and sure, as a pharmacist, you can give them information like, I wouldn't take cocodamol with extra paracetamol, but if that's their own, their compos mentis, they don't listen. I mean, it's up to them, but you can only be there to give them clinical information. To that vaccine itself, it was a bit difficult because, say, 6 months ago, even I wasn't sure. I was reading studies, and my mum was a fertility specialist in Abu Dhabi, and I think this was with the Chinese vaccine, one of the Oxford trials. A patient that she was dealing with came back with a really low sperm count. But and obviously there were studies where it dropped in your sperm count, but essentially sperm count is something that regenerates, as days go on. So that obviously took a life of its own, people thinking that it affects your fertility when it doesn't. There was a lot of misconceptions, and all it took is for people to have the vaccine and think, oh, I'm still alive after the vaccine. Like, I had the vaccine myself. So there's a lot of apprehension, obviously. But it was.
Do you think that it could have been put better? Like you said yourself, like if you give patients the information, if you give them the basic knowledge of how it works, they're more likely to make that choice for themselves. Like, as far as I can see, so my criticism has always been of, like the campaigns is getting a celebrity and just telling them to tell someone to take the vaccine isn't going to work. Whereas if you give them the knowledge that, look, this is why you do it. If you don't do it, this happens. Or
100%. Usman, I talk about it in risks and rewards.
Yeah.
And I tell people, after that first dose, I had 45 minutes an episode of a headache, and I had 1 episode of loose stools. After the second one, after a training session, I was just wiped out for 2-3 hours. I had a nap.
Yeah.
So if you think of those symptoms, what they were like after a vaccine, you multiply that by 50 or 100 to get the actual virus. Does that make sense?
Yeah.
And I know people have felt a little bit rotten after the actual vaccine, but I always say it's better to feel that than what the actual virus does, because the virus, those symptoms, you have to times them by 50 or 100. So if you're wiped out for a few hours after the actual vaccine, after the actual virus,
imagine what the real virus would be.
12 days. So I often say it's risks and rewards. Would you rather feel lousy for 2 hours or have a headache for 45 minutes? or would you rather feel lousy for 10 days and risk, having secondary pneumonia or, not being able to function and stuff like that? And
Being hospitalized, basically. Yeah.
Yeah. Like, I know a lot of people who were banging about their drum conspiracy theories, and then they end up in the hospital, and you don't obviously want them to end up there. No, you want never ever end up in the hospital, but you must think, well, this is the outcome of the virus, sort of thing. Like, so you have to explain things in risks and rewards. Do you want to have a little risk of a headache and feeling lousy, or a sore arm for a few days, or do you want the virus and do you potentially want to die? It's like that sort of thing. And it's the same with you, Usman. It's the same with you guys when you get the medication. Like, oh, statins, they're going to hurt my legs and leg cramps. Well, do you want leg cramps? Do you want muscle pains, or do you want to have a stroke or heart attack in the next 10 years? I know which one I want. Like, with medicine, it's about risks and rewards, really.
Yeah, it's about educating the people. But I think, like I said, a lot of the things, they've not been done. Like, that's always been my problem with all of these campaigns. Like, something I've been talking about for weeks now. I even posted it on Twitter and everything. One of the reasons why you should get the vaccine is after the first dose, even if you've only had one dose, you automatically, because obviously it gives your immune system sort of a head start, you're pretty much, well, not say impossible, but your chances of being hospitalized are very, very slim, because now you've given your immune system a boost. So I was talking about that weeks ago, and now it's sort of starting to filter into the news. But this is what I'm thinking. Why does it take that long? Why do you think it's taken that long for information which is simple, concise as that, to say, look, get the vaccine. You're unlikely, even if you get the symptoms, you're not going to be hospitalized by it.
Okay. Yeah, good. You got to think, it's easy for me and you because we deal with medics and medical people every day. We're in a medical environment, but the general public, their only experience.
But I'm talking about government-wise. Like, what is stopping them from putting information out like that to make it easier for people to understand?
The thing they have, and I just think the general public just do not trust the government. They think the government are lying because they've had Matt Hancock come with this conflicting stuff. No one trusts Boris Johnson anymore. So anyone in the government who says this, they're just gonna poke holes in it. So it takes. It's one of those things that, fast forward a couple of months ago, no one trusts the government. Now more and more people, more and more medical professionals, more and more regular people are saying, and it's the power of social media. Like, it's, if one lie spreads on, like the stuff about masks, like masks being dangerous and masks causing hypoxia and masks causing pneumonia, like that spread on Facebook. And, obviously if no one's medically trained, they'll read that and think, oh, that's true. And it's like, if that was the case, your dentist would be dead every day, like from having to wear a mask, or people in hospital,
left,
builders. There'll be no dentists left.
Yeah.
So it just goes back to people's livelihoods being compromised or challenged. Having to arrest, why should I have to wear a mask? It's really dangerous for me. It's not really. You're just making that up. So it's just, I think it's people's trust of the government and trust of everything that's going on in the media. But more and more things are coming on in the news now and everything in the media.
Okay, so one of the things that we've seen, obviously, I've had unfortunate personal experience with, is that obviously people of a certain age, obviously, they're contracting symptoms and unfortunately they're passing away. So a lot of people seem to think that it's a disease which is dangerous only to like the elderly or the over 60s or whatever. What would you say to someone who's maybe 30 years old or 40 years old, thinking, well, it's not going to do anything for me. I don't need to get the vaccine. In what cases would you say to someone who isn't of that age group that, look, you still need to be careful? Is there like risk categories for certain diseases?
Type 2 diabetes, asthma, COPD, any heart problems, any ongoing liver issues, blacks, Asians, I think minorities. And I think the link with there has been the low vitamin D levels, which is, common in us Asian people. I think minorities as well. I mean, you can even see it's one of those things. It's affecting everyone. Obviously, if you some people recover more than others, in the people in the 20s, 30s. But again, people are overweight, high BMI, asthma, COPD, these common things, type 2 diabetes. Even if they're fit and well and they're running on sort of low vitamin D, or have a deficiency of some sort with folate or B12, it's one of the things that can affect everyone. It's such a strange, unpredictable, cruel, aggressive virus that you can't really pinpoint, who it affects. Obviously, if you've got a better lung function than the next person and a better VO2 max, or, you're athletically fitter from your lungs point of view, you don't smoke, you may recover a little bit faster. But again, I know very athletic, fit people, professional athletes who've been wiped out for weeks with this virus, not necessarily hospitalized, but to the point where they'll be wiped out for 7 to 10 days. And even when they go back to exercising, like walking a few hundred meters is an absolute struggle to them,
Yeah, I think we saw that even in the Premier League. Like, I think Pogba had it and he wasn't fully fit for ages. St. Maxim from Newcastle, I think he had it and then it took him a very long time to get back to fitness as well. So,
Exactly,
yeah,
man.
even athletes, the peak performance athletes, if it's affecting them, then, who are you basically?
The professional boxer I work for, fighting in a few weeks, he was wiped out for 2 weeks.
Wow.
2 weeks, yeah.
Yeah, and
he's fit as a fiddle, that guy.
Yeah.
Again, like, that's the thing, and because what it is, people don't realize it's not just the flu, or
that's what annoys me the most. When people just say it's just like the flu. Look at the death rate. It's just like the flu.
Oh, it's 0.1%. 0.01%. I don't know where you've got that from.
Yeah.
But what happens is this virus will enter your lungs, enter your respiratory system, and cause fibrosis. It'll break down all the lung tissue. So when the lung tissue breaks down, you're susceptible to maybe a pneumonia. A pneumonia is, a chest infection, which is seen on an X-ray. So like, that's the thing. When you get people that worsen after 7 to 10 days and really deteriorate, that's when it gets problematic. But
is it also true that, a lot of people say that, they throw this number around, this 0.01%, is even if you recover from, say, if you get COVID and you recover, there's still chance that it leaves lasting damage, which obviously isn't taken account into any of the, the statistics. They don't say that. It's basically, you've had it, you've recovered. But like you said, if you're getting fibrosis in your lungs, there may be permanent scarring, or there may be some other organs of your body. Is that true?
Yeah, of course. So, like, to the point where you may walk, say, for example, you're a fit and well guy, but you may walk 30 meters, start to get chest pain or be breathless. That's the effect of COVID. Walking upstairs, and you walk up 4 stairs and you're absolutely breathless. Should be
like, I'm talking about even when you've recovered, you could still have some sort of lasting.
They're the symptoms. They're essentially.
Oh wow! Okay, that bad. Okay.
Yeah. I know people that have recovered, been out of bed, and they will sort of walk a few hundred meters and be out of breathless. One of the nurses who I knew had it, she was like, it's like trying to charge your old iPhone with a new charger or something like that. Like, you put. You some days you'll feel good, some days you'll feel bad, and it'll be a fluctuant of energy.
Wow.
And that's the thing, there's long COVID clinics now, where people are experiencing these symptoms for 3 to 4 months after the virus, and then we have to refer them to these clinics called long COVID clinics, where they probably need a CT of their chest and have investigated further. So, I mean, I've never known the flu to do that to anyone.
Exactly. Right. I think you already touched on this already about, the reasons why people should take it, especially ethnic minorities, due to low vitamin D. So in the papers, especially I've seen in pharmacies, we are inundated with requests for zinc, vitamin C, and vitamin D3. Is it true, or is it just talk? Is there any scientific basis behind? I know that you've confirmed that the vitamin D is, but the zinc and the vitamin C?
Vitamin D, definitely. There is a link between, low vitamin D and poor immunity, and susceptible of getting infections and, your immune system. Vitamin C, I mean, there's so many other benefits of vitamin D as well, like sleep, energy, general well-being. Zinc and magnesium, I'm not too sure. I think the big link is vitamin D, to be honest.
Yeah.
That's the big one. I mean, you typically with it accepting Asians, blacks, ethnic minorities, they're historically deficient in vitamin D.
Yeah.
Sunlight and everything like that. Vitamin C and zinc,
You wouldn't put on the list, but I think it just tends to have people just tend to link it with immunity in general rather than sort of specific to COVID.
Yeah, but I think vitamin D is the big one, 100%, 100%. Yeah.
Okay, so I'm gonna get onto something probably a little bit controversial because everyone I've talked to about this, they're like, "Oh, you can't say that, you're a healthcare professional." But anyway, two main brands of the COVID vaccine in the UK at the moment. I think that there is another one, but let's just stick to for the purpose of discussion two. So we've got the AstraZeneca and the Pfizer.
Right.
So just as a quick overview, obviously correct me any point if I'm wrong. So the Pfizer one is the mRNA based.
Yeah.
And the AstraZeneca or the Oxford, whatever you want to call it, is sort of, as far as my research goes, it's like a modified version of the flu jab.
Yeah. It's a difficult one. I haven't done a lot of reading into the AstraZeneca one. I mean, I know a lot of people that have had the Pfizer one and they haven't experienced as bad side effects as they would with the Oxford one or the Chinese one, if they're living abroad and stuff like that.
Yeah.
So for me, for what I've seen with patients and myself, I probably lean towards the Pfizer one just because the side effects haven't been
okay
as the complications and everything like that. The common ones are, you're left with a bit of a sore arm. Some people might get a headache, loose stools, and they'll either get it after the first dose or the second dose more so. But AstraZeneca, I don't know too much about.
Okay. I'll give you my point of view, and then obviously you can counter and tell me whatever. I, out of the two, would prefer to get the AstraZeneca.
Why is that?
Basically because of the way it works. So like I said before, obviously the Pfizer one is based on mRNA, and as far as my research goes, mRNA as a mass vaccine program, mRNA technology has never been used previously in a mass vaccine program. I understand there's certain medicines which use mRNA, but they've never been done on a mass scale before. So the AstraZeneca being a modified version of the flu jab, which is something people have been having for years and years and years. For me, I feel as though that, in terms of long-term, the ability to confidently say that as in a long-term basis, it's less likely to give you side effects. I go for that one, and I've got my dad to get that one, and my mum's got that one purely based on that. I understand that I agree with you that people who've had the Pfizer have probably had less side effects, and the Pfizer has also been shown to be more effective. I think it's like 95 versus 85 or whatever. But for me, that's my reasoning behind it. Now, what would you say to that? Would you think there's something in it, or do you think that 50-50, or am I completely wrong? Or
no, I don't like. You probably obviously know more than me with that respect. You know what? I just say whatever's available.
Just get it.
Take it. Yeah. There's one which is absolutely dreadful. Is it the Chinese one where it's like you get terrible side effects and it's like 50%? I think I was just like, you might as well just get the virus. Like, I think it's the one in UAE at the moment. My mum had it, and she felt feverish for like 3 days.
I thought they had the Pfizer. I thought they were the first country in the world to get the Pfizer.
No. This was like, they've had it in that Pfizer now, but it's Pfizer and the Chinese one, and obviously the Chinese one now. But to be honest, like I think we're just playing tit for tat. If you get a vaccine, just take it. Like,
get it.
It's just again, I've never met anyone I've never come across a patient that's had the vaccine and then went and got COVID. You know, I know you hear about these things in the news and stuff like that, but I've never come across anyone that's had the vaccine and then got the virus, if that makes sense. So
yeah,
it must be doing something. And
100%.
I think we're going through age groups at the moment. So our practice are calling patients who are 50 to 59 at the moment. So next week it'll be 40 to 49, and it's going down, like, you know, like that sort of thing, age groups. So we've covered all the clinically vulnerable and the elderly. So we're just working our way through the age groups at the moment. It'll be interesting to see how much of the 20 to 30-year-olds will be take up the vaccine.
So this is nicely leads on, segue into the next one is, so a lot of people of that age group will probably say no, or probably say, oh, I think I've already had it and I'm okay now. So is it, like, from a medical point of view, say if you've definitely had it, you've confirmed you had a test, it was positive, you've had your 10 days, you've ridden it out, and that's fine. Is it okay for you not to get the vaccine?
It depends when you had the virus. If you had the virus this time last year, you might as well just get the vaccine against its antibodies and how long the exposure was to the virus. If you had it last week or a few weeks ago, okay, fair enough. But if you had it May 2020 or June 2020 or April, you might as well get the virus, because you're as immune as the next person, because obviously it's exposure to the actual virus itself. But going forward and knowing how unpredictable, cruel, and deadly this virus is, I can see us needing this every year. You know, the flu jab.
Exactly what I was going to say next, actually.
6 months, maybe, but it will be definitely every year, 100%. It will be a yearly thing. You know, like the flu vaccine is, and so
literally said what I was going to say next. That my prediction was that, you know, a lot of people saying, if you're worried about getting the vaccine now, don't think it's going away. It's every year. It's every year now.
Flus, like, it'll be like the flus every year. Obviously, they roll it out like October, September, November, and obviously the carers and people high risk can get it. But like me and you would get the flu vaccine, obviously, because we're in that thing. But it will be every year, and it might be moving into like private things as well, like private clinics and stuff, which will be interesting. Like me and some guy talking about setting up a COVID clinic, which is in the premature thing. But he was saying, like, do you think we could start giving the vaccines? I was like, that not now, because there's such a shortage of them, but potentially in the future.
I think going forward, I think even we've been like briefed on, you know, towards beginning of summer, where there's, you know, the people that are left over. I think we're going to be taking some of the strain and just doing
but right now
system.
The government are like at a shortage, like they're really like keeping, it's like gold dust at the moment. AstraZeneca, but I'd say by August it'll be widespread sort of thing.
But I think we've covered the main topics, and I really appreciate you taking time out. Like I said, I know that you're very busy with your clinics and obviously your sports work, and you're putting out podcasts. Like, every time I check your socials, it's like every other day. So I'm like, honestly, you know what? It's motivated me loads. Like, ever since I've got in contact with you, I've felt, you know what? The brother's doing so much. He's got so much on his plate. He's, you know, mashallah, he's a doctor and he's doing but he's not stopping. He's like, if you can do it, I'm thinking, you know what? I should be able to do it as well. So thank you so much, man. You've motivated me a lot.
And I'll share it on my page. I just want to push this and stuff. But I appreciate having me on, man.
No, I appreciate. Now everyone has the, you know, a little creative outlet. You know, obviously we're men of science, but you know, we've got that little thing inside us where we wanna do something else as well. We need that little outlet. But I understand. You know, it is. I've been meaning to do it for so long, and then, you know, now that I've met like-minded people like yourself, you know, you're on 94, man. You're just absolutely smashing it out.
Definitely, man. Definitely keep in touch, man.
No, 100%. Thank you so much for joining us. Make sure you check out Dr. Usman's podcast, the Dr. Us podcast. The links will be in the description. He's got amazing stuff. Make sure you definitely check it out. And I'll see you next time. Take care. Goodbye.